So say one of your patients seeing you or seeing a hematologist, maybe a local hematologist who doesn't see a high volume of CLL, and they ask what do you think, or they ask of their doctor, what do you think of me getting a second opinion on my diagnosis? Because patients are scared for one thing and they want to make sure that they're making the right decisions for themselves. How do you feel about patients seeking a second opinion?
I always support it. Of course, with me, I am often the second or even higher number of opinions that has received, but I certainly, I'm not at the biggest cancer center in the world. I trained there, but that's not where I'm at now. So I've had patients that have that have gotten even a second or third opinion from me, and then go off and get a fourth opinion at MD Anderson. So in terms of what I want patients to understand with opinions is, one, if you get a lot of opinions, it can just make it kind of difficult. And so I don't know if I would really support a large number of different opinions. I think certainly getting a second opinion is reasonable, but whenever you're seeking another opinion, I think it really only makes sense if you're going to a higher level of specification. So certainly it makes sense to go from a general oncologist and getting a second opinion from somebody like myself that sees a lymphoma as a specialty and does research in CLL. But if you're already seeing a CLL specialist to then seek another one, I think maybe if you wanted to go to even a bigger cancer center or someone that has maybe published more over more years, that's fine. But it certainly doesn't make sense to go from one CLL specialist to somebody that is maybe even less focused in CLL. And sometimes you'd have to kind of be aware of just where you're at. In general, the specialists are going to be at the larger cancer centers. You might find the name of a larger cancer center on a small cancer clinic, and it's unlikely that just because the name of that well-known cancer center is on a small clinic site that you're going to have access to a lot of specialists at that site. Usually to support specialists, you have to be at a large, usually urban located cancer center.